Well, hello everyone. My first cognitive challenge for you will be to understand my accent. And I would say that I noticed that Dr. Jacob had a secret weapon, which was a high heel. So, yes, okay, I should have thought of that. Thank you for having me here. This is really a topic that I'm very passionate about, and I hope we will make it as useful as possible for you. I will be torturing you next. I call it torture when we do some exercises, but hopefully we will have some fun with it. So I really wanted to share that this is our goal for today, and what I really intended to is to just share some knowledge that when you think about an exercise program, what you should be looking for, you know. So here we have represented. So Sarah Rigard is a person with Parkinson from Sweden, and she represented how she felt in her self-care with Parkinson. So what she represents here is like, I spend 1 hour with my neurologist per year. I spend a couple of hours with my physiotherapist, and then I'm on my own all the rest of the time. And this really represents how important it is for us to think about these kind of events and, you know, sharing knowledge and really helping you to make the best choices. And the reason why we're talking about this, and I can probably give you a practical example because this is beyond my imagination in terms of environment of multitasking. I always get surprised about how big everything is in America. And when I was told that 600 people were coming, first someone told me it was 200, then it was 400, then suddenly 600, now it's 650. And so you can see how the negotiation and all the multitasking that will be happening already today. Some examples that we have is, how many of you have ever felt that when you're walking and then suddenly you want to say something that's really relevant, you feel the need to stop? So let's code our interaction here. So right hand will be yes, and for those that are lazy that don't want to raise their hands, no will be on the left. So how many of you have had that feeling? Okay, so I get a sense of how difficult things are. And so imagine other examples, which I think is more common. We're sitting in the couch in our living room and we decide to go to the refrigerator to get something. On our way, somebody talked with us. We get to the refrigerator, we open it up, and then we don't remember what we were going to get. How many of you? Yeah, I would imagine. You don't even need to have Parkinson for that, for sure. Yeah. Then we have another example. So these are all examples of things that have been studied in terms of the perception that people have of these difficulties. And so we have several ones like the lowering your cup when you're talking with someone. So I know that in America everything's big, as I said. So this is a picture that I took of this cup that I was just fascinated with the size. And our cups will probably be like this. Your cups are like this. So it's really not about the size. So even if you change the size of the cup, you will still have this effect, because it's really about being able to divide your attention between two tasks. And this is what dual tasking is. It's being able to perform two tasks at the same time. And I'm probably saying that tasks. I know everyone always keeps correcting me on the way we say the R. Okay, so it's one of those, I would say, impairments that do happen early on. We now have data that it is identified early on in the diagnosis, but we don't seem to talk about it a lot. And so it's something that's coming up. And it's usually related to the fact that it's not perceived so well. So we don't identify it. Because if we did know that there was difficulty, we'll probably be more focused, right? A good example would be walking. So if you're walking, for example, if we have two people that are sitting exactly in the same chair and they are going to go and get some coffee. So if one person is focused on the coffee, he will probably take longer, he might drag his leg more, or not move his arm so much as they get to the same place. This is the influence. If the other one's really thinking about his feet, he'll probably get there faster. Then they pick up the cup and they're coming over. So what we know, and this is also based on a research study that was done with similar protocols, if you're coming back with the cup and you are focusing on your feet, then you will probably get here faster with the cup. If you are focusing on the cup, you become nervous, you start thinking about not letting it fall, and so you'll probably hesitate and have more difficulty. Okay. So this has been targeted in terms of research for the cup for the last 10 years. We really have identified how cognition really influences movement and vice versa. What we need to think about now is how we're going to deal with it, right? So we do know that there is an effect, obviously, on problems like freezing, your feet getting glued to the floor, hesitations when you're turning. There is also influences on, how you're walking is the size of your steps, and those influences that I was saying in terms of motor performance, right? Now our next step is really, okay, so what approaches do we have for this problem? Now, on one side, we do have this intervention called cognitive training that you probably hear about it, maybe practical examples like Sudoku and all those luminosity. So you have all these interventions, these cognitive tests and cognitive training methods. Then we also have the motor training and how we know that how exercise may influence also cognition. And then what about if we combine it? So this would be ultimately the question is like, why would we be combining? This is what we call dual task training. As I like to represent it here as a spork, because I'm fascinated by this idea of the spork. So you do have the spoon, you do have the fork, and we do use it in different moments, right? So what really makes sense is it's probably useful. All these interventions are potentially useful for certain situations and contexts. And this is what we have been trying to figure out now. I did want to give you a vision of how did this evolve, and I think it's interesting to see how new interventions come up, and so I just summarize. Luckily for us, or unfortunately I would say, because we always want more, there has been few research in this area. So about the cognitive deficits and impairments, there's an enormous amount of research on that. On the training of this is less. So this is what we're working on. So I just wanted to share with you, back in 2004, this is when, more or less when I was finishing school, the guidance that I had was, don't teach your patients to dual task. And I was quite a rebel at that time, so it's like I was looking at that and I was like, wait a minute, how can I teach them not to do it if that is part of daily life? If everything that I do in a clinic is to try to mimic something that happens in daily life, this does not make sense to me. So I would have situations where I'd have someone coming in and their main problem would be, okay, I can't stand up alone. And then we would be training, okay, obvious things would be, let's just train sitting and standing. And we'd be doing that for, imagine, a month or 2 months. And how long would it take to continuously train something and realize that it's not working? It wasn't enough. And so, because I was very privileged to have many hours with my patients, so I'd have like people coming in 2 or 3 times a week, ongoing therapy. So I really had a lot of time to try things out, and you'll probably see that in the videos as I will show you. But the question is, it comes to a point where you start questioning even things that you're reading. Now, we can understand why this was happening. This don't dual tasking is because it was really the impact it had that we were seeing in the research and the risks that it implied. So people were placed in falls of risk every time they do some kind of dual tasking, right? But continually being a little bit stubborn, I did decide to, okay, I would try to convince someone that, okay, this is important to do, but the only backup that I would have would be, I just know. That didn't get me far, so. But I was persistent, and I just wanted to show you at that time what I was thinking of. Okay, so what I just know looked like. Let's see if I can get this. I really believe that the balance exercises were really boring. How many of you think balance exercises are boring?
Quais são as cores das letras que estão à sua frente?
So, and then you start thinking about, okay, what do I need, right? If I have small movements, if I have slow movements, if I have small movements, I want big movements. If I have slow, I need something fast. If it's fatiguing, then I have to have some kind of intensity.
Continua a bater a bola.
If I have balance issues, then I... So these are all the ingredients that I need to put into an exercise, right? And at that time, so this was what I was thinking, is like, how many sessions would I be able to get away with putting someone on a balance pad and training balance? Does it really represent what's happening in daily life? And for sure, so I was really stubborn with my thinking at that time. It's like, no, it has to be, I have to mimic what's happening in daily life. And what happens usually is the person is so distracted, so you're talking with someone, and the same example of getting the coffee, you probably cross by someone and you start talking, and then your posture starts going down as you are feeling more imbalanced in a dual task situation, right? So what I'm actually doing here is I'm challenging him to say, so sorry, it's in Portuguese, but, so tell me how many letters do you see that are pink? How many are blue? And so if we have this amount of blue ones and red ones, how many will it be? So it's just like engaging. To some extent, we already do that, because when you're doing therapy, you're already challenging the person to listen to your instructions, and that's already a dual task, to respond while you're doing an activity. Going through a busy environment in the gym. This is really a great example. I was sitting outside watching everyone coming in. I was like, wow, I should be filming this. This would be a good film. So you could see your success. It's impressive. So the world, suddenly we're getting all this evidence about how risky it is, but then finally the first pilot study comes out from Australia in 2008, and I was like so happy, because yes, it was my validation that I wasn't mad, and so I could get away with it more. This was really a changing point, and so we just started seeing more and more pilot studies and challenging activities coming on. So I would say the world was divided through this, the people that defended it, the people that don't. And then I had the privilege to be part of this working group, which was the European Parkinson Disease Physiotherapy Guidelines. So it's 19 countries that came together to sit down on a table and to decide what would be the recommendations for core areas of physiotherapy. And when we came down to this one, believe me, it was really, I have no word to describe it. So you'd have different countries like the UK, and the Germans would be more quiet. So you'd have all this interaction about beliefs and what our professional convictions were about this type of training. But in reality, not many people were applying it at all. So we really had to base our decisions on what the evidence suggested. At that time, it's a turning point. It's a turning point because, okay, we can't tell people not to do it because it's part of daily life and people are already doing it anyway. So we can maybe guide them to think about situations where you want to try to avoid it, but we should not recommend not to train it. So this is the first time that we really have this information. Okay, it's okay, we can train it with some support from recommendations. I think now in where we are now, we are still in the second RCT, as we were talking about the randomized controlled trials. So the last one that just came out last year, I think was very interesting, where now we're trying to understand, okay, so if we have the spoon and the fork, and then we have the spork, and then, if we really compare it, which training would be more effective? The results were surprising. So both interventions really had similar results, but what we really take from this is how we could apply it. So in certain situations, it would be more reasonable to start with the fork or with the spoon. And they managed to analyze in subgroups like people with freezing of gait, people with more difficulties in cognition. You'd probably want to start from something that's simple and then eventually progress to something that's more complicated. I think this was just confirming things that we were already seeing. And it also helps us, guide us in how we're going to apply this kind of new intervention. I don't usually like to call it new because I think it's something that naturally happens in the treatment sessions, because we are always adding on some kind of complexity so we can make activities harder and harder and challenge you so we can get better results. That is the ultimate goal. But when we really focus on, so when would this make sense to use? It really makes sense if the person identifies this problem, because nothing will change if you don't identify the problem, right? So as I said, this is present already at diagnosis, and it probably is related to the factor that takes you to the takes you to the doctor for diagnosis, which is I'm walking and my arm's not swinging anymore. I'm walking and I'm dragging my leg. In what situation does that happen? It happens either when it probably increases and is more difficult when you are doing something else at the same time. Okay? So this would be the main goal, is to really teach people that we can add this type of training in any intervention that we are already doing. And I will give you some examples on that with videos. It also helps, what I find it helps to keep it challenging and interesting, especially if you're doing ongoing therapy or community-based interventions, and it also makes it more fun. And I would say fun is the new element, or it should be the new kid on the block, because doing exercise forever and ever is, it's quite a challenge that we ask people to do. So I did want to give you an example. Okay, so one of the criteria that we could use for when do I apply it, should it be, age-based? Is it functional needs? I mean, everything has to be really reflected on. So I did bring you two examples. So on your left, let me see, we have Antonio, oops, sorry. Now I understand computers are different. So there's buttons in the bottom, there's buttons on top. Give me a second. I hate technology. I just did it. Yeah, could you stay here with me? Thank you. So dual tasking. So I just wanted to bring you, so Antonio is 91 years old. So I said, okay, I really have to, two extremes of age. Would it make sense to apply this type of training? So imagine that what I really want to keep is the person safe in terms of, prevention of falls. And so sitting and standing is a very basic exercise that we use. And then how many times would I repeat this? And okay, I want you to sit and stand 12 times, 15, and to really make it engaging and to really represent what's happening at home and when he gets distracted and he might fall. So we just challenged him to, I want to keep the quality of the movement. And that's why I'm using boxing as an example, because I know it's very popular here. So it's just, he's engaged in the task of reaching that boxing ball and hitting it, right? But at the same time, I'm giving him two words that I want him, that initially I put it on in front of him. So I want him to alternate between one word and the other. So that means I want him to spell out that word with the right hand for one word, with the left hand, the other one. Now, I know it sounds complicated, but remember, he's 91 years old and he got it. So it's progressively introduced. And then what I do is I'll take it away. In this case, I'll take it away and I'll challenge him to do it by himself. And he did it. And then, okay, then he got it. Now, the next thing would be, can you do this faster? So I wouldn't complicate it much more than that. And I'll just be adding in very carefully different challenges. Oh, yes, I got this one. Okay, then on the other side, you have someone that, who's a businessman. He's Johnny. He doesn't really like exercise, so I have to find engaging ways to keep him active. And at the same time, can I challenge him cognitively? So without assuming that, telling him, okay, you have this difficulty. Cognition, I know it's going to be approached in more detail in a next talk, so I won't go into details of which cognitive aspects we're talking about, but it's really, the focus here one of the main ones is this attention and the capacity to divide your attention between two tasks. And in this case, he would have, a red balloon and a blue one. And so with his right hand, he has a blue glove, he has to hit the blue one, and with the left, he would have to read the red one, right? And then obviously, I would change that. I'd say change, and so with the right hand, he would have to hit the opposite. As I said, it's just, we made it more challenging, and I can keep him in this activity for much longer. We are changing continuously the exercises, or else if we were repeating it, we would have to be really creative in how to complicate it, right? And this comes in line with, if I complicate it too much, it becomes unsafe. And this is where the concern was in 2004. Because as people are doing and adding in tasks, their symptoms or their baseline can increase, right? So you can have the tremor increasing, you can have freezing coming on. So it's very important that we are aware of this. So it's not just, okay, walk and tell me the alphabet in reverse. I mean, if anyone tries that, it's like the worst thing you can ask someone to do, right? It really slows you down. You really don't feel, it's frustrating. And I only use it when I really want to prove a point. But I think that we should all be aware that this practice will probably explode in the next 5 years. And so it's just be aware there are limits, and don't allow anyone to do something uncomfortable with you. Just ask them to do it and see how they feel. That would be my first tip. Then I did want to give you some examples. It is possible for us to control some of these, side effects or adverse events that happen. And one example, of course, the bicycle is always a good example. That I try to put on. So someone that has unpredictable offs, for example, that suddenly you can be adding in a task and then he goes in off, and might be someone that you really want to keep some level of activity. The bicycle is always a good option for aerobic exercise. I mean, everyone talks about it. What we just did here, we just added in, okay, so you have one on your left and two on your right, and I'm giving him instructions, and you can see that he stops cycling as soon as he's trying to think, right? So there is an influence. You start compensating because you're focusing on what you're thinking, so you lose the movement. So if you think about, for example, on a treadmill, if this happens on the treadmill, you start shuffling your feet, right? So that's not so positive. I think here in the bicycle, we can guarantee that you are training both the motor and both the cognition in a very safe way. So that's also a good example for the home. I think things that exist in the community, I don't know how common it is to have hydrotherapy here or hydrogenastics, but it is a challenge to do exercises, for people in the pool, because there's only so much you can do in a pool, right? So by adding in this type of practice where I'm challenging them to, for example, spell out a word, and they have to, what they're training is auditory attention. They have to repeat what the other one said, and then say the next letter. And so they really have, they have fun when someone messes up or something, and because they're friends, right? We don't want to. It's like I was telling them, do you mind if I show these videos? And like, we're going to America, yes. So they were all very happy with that. The gentleman that was 91 years old, I think, was the funniest, because he goes out of I said, do you mind if I ask your father, your son to, if we can take the video, and then as well, because it's age-related. And then he goes out and says, I'm going to America. And the son is looking at me, and is like, no, it's just a video. Just, okay. So I'm very fortunate to have people allow me to videotape without big problems. Then I know that it's more difficult in some places. So we were talking, the treadmill is also a very typical place where people do training, either in the gyms or with the physiotherapist. And this is just an example of, okay, I do know if I do add in any other additional task, we are going to have complications. So I might as well, I have to guarantee that the amplitude of the movement is good. So this is why he has all these references that he has to touch. So sometimes it's not about adding in something else, say the letters that start with a P or whatever. It's the instructions. And the way that I give the instructions will make it more complex and make you think, right? So twice with the ball, 2 or 3 times with the kick, and then, of course, allowing someone to really react on this. This is someone that comes in the gym 3 times a week. They have no complaints at all. So we do challenge them to the next level. And we are receiving more and more people that have just been diagnosed. And so that means we have to be prepared with new things, because we can't be using the same, right? So in this case, either the elastics are helping him or challenging him, but he is doing like a Stroop exercise that you will be doing next at the same time that he's doing this. his arms weren't moving. So as I'm trying an exercise, okay, now I'm losing the arms. So now I have to find a solution for how am I going to facilitate the movement. Simple things like put the bottom part of your foot or just changing positions in the foot would be complex on its own. And it's really about the change. Then I think we have new challenges, which is, group therapy, and community-based therapy is really strong here in the US, and so it's. I had the privilege of implementing a boxing program in Sweden, and it was interesting the results that I saw. I asked people which part of the class did you like most, and it was curious to see that the results were people like the warm-up and the cool-down more. Now this was shocking results, and it's just because that's the only moment where they were together. And they were actually doing an activity together. So that's the fun moment where you push your colleague or you play with. And when we use boxing in circuits, we isolate people a little bit from that, and they feel more lonely going from one place to another. So this was just an example of, on one side of the wall you have letters, on the other side you have numbers. And what I'm challenging, so it's an individual challenge of, you have to go through the alphabet, and I'll trust they'll do it right, or honestly, go through the alphabet from A to 1, B to 2, 3. So everyone is taking their time, they're negotiating the environment, which is something that would happen naturally if you're in traffic or, the subway in Europe. And I managed to get some time to be with people that are with more difficulties, so I'm going around making sure that they are safe. And at the same time, it is a group activity, and everyone understands that they're doing the same thing. So when I tried it out, I was kind of scared how the shocking was going to. What happened in the beginning was Portugal and the UK were competing. So you have always the reckless behavior, or I would say the more competitive people that you have to watch out for. But I think it worked out. It's just an example that we might want to consider. How can we do group activities without and being able to keep it safe? Although I think what we're going to try today with this amount of people is we might as well register on the world record of Guinness of non-safety or safety. We'll see how that goes. Yes, I did also want to share that. So I'm finishing up my research with my PhD, and it's really about can we contribute with developing new programs, and the acceptability of these kind of new interventions. And one of the examples that I wanted to show you, yes. So it's the combination of movement, voice, that I asked and the cognition component of it. So the speech therapist that I was working in, I just, would you come in and, guide me on what type of voice exercises do you usually do? And then I'd complicate it a little bit. So it's really about getting functional activities. And then what we're doing, we're counting everything in Portuguese, we count everything in English, and then we alternate between one language, one number, the other number, another language. And if you do speak two languages and you try this, it is quite difficult. And it's because you have different types of difficulties, of people with difficulties in the group. And it seems that these kind of cognitive challenges really brings people to the same level, which is interesting. It doesn't really, even if you run a marathon or something, when you add in the cognition, you're going to have equal difficulty. So that was also a fascinating result. Then one that I think is more difficult to, how would I say this? I would say I just know. For now, I'm still in the I just know that this might work. We don't have evidence on this, and I think it's an out-of-the-box idea. But it's really my despair of being able to add in complexity without worrying that someone's going to fall and hurt themselves. So this is a new intervention that we're applying, all this kind of dual task interventions on trampolines. And so I was fortunate enough to have, this whole playground of trampolines in Lisbon for the first time. And so is like, I have to go there. And I actually managed to convince them, would you allow me to use this for Parkinson and to really focus on, how applicable this might be for balance, for freezing. And I must say the results are really enthusiastic. And I hope we get I hope the idea spreads and somebody tries it in a big study, because I think from what we see, we need urgently solutions for freezing and falling. And I think everyone is very desperate to find solutions for that. Now the next one, it's also trying to combine the cognition and how can we get this in a simple way that people, that you can spread ideas and have people try it out at home. So this was just a cognitive program that's called CogWeb that landed up on my desk, and I was like, and I tried it out, and I honestly found it very boring. I said, okay, how can we make this more interesting? And then so we decided why don't we, instead of clicking on the mouse, and answering yes or no, and so you have the cognitive tests, why don't we just answer with movements? And so we tried it out and actually worked really good. I think it's a simple idea that can be grabbed onto. Then we got this grant to be able to apply it at the Parkinson Association, and it doesn't really matter. The inclusion criteria was our first challenge to see who we would include in these kind of programs, but we did do trials with different people coming in. We didn't even know who was going to come. And it did work out, so I don't think there has to be a limit, as long as you're choosing, because you're adapting the exercises according to the response that you see from the group. And so more than seeing someone else do it, I did want to challenge you to do it. Is that okay? I think it's time for us to move a bit, and so I will jump into an exercise that we do use with the CogWeb and see how that goes with 650 people. So, okay. What we're going to have here now is, you're going to see, everyone can access the screen, right? So we're going to have different instructions for the bird that will show up on your screen. So if this green bird is on your left, we're going to keep it simple. Our left arm comes up in the air, okay? If it's on the right arm, simple. If the bird is outside, you will stay seated, okay? If he's outside the cage. If he is inside, then you have to sit and stand. Okay, now remember, everyone has different velocities of thinking and memorizing the information. Let's just try it out and see how it goes. So we have the bird. I have to turn around to see, okay? I want to see who stands up first. Okay, so the bird is in the cage. You have to stand up and sit down. And I checked the chairs are really good, so you can actually try this with... Okay, now I'm going to speed it up. Okay, we're really warming up. Okay, now because I think you guys are too quiet. Let's add in, I have this impression that in America you speak more, right? So I need to hear your voices. And so I'm going to challenge you. How about we say left, right, according to the answer that we're giving? So we just see if you can convince me. Okay, so if we go to the next one, this is inside. Okay. Louder. Okay, I see. Okay, so there's multiple ways that we can complicate this. I could ask you to, okay, well, how about you saying left when it's right? Shall we try it before I go on to the other one? just to see what happens. So I haven't tried this. So if you see the bird on the right, you are going to say left. So what we're changing now is just what you're saying, okay? Let's just try it. So here we would say left, but we're going to say right. It's okay? You see how your voices got softer? How the hands are? I'm not really convinced. Haven't had a sitting and standing yet. Okay, so it becomes less fun. But it's still engaging, I think. Another way to do it is, let's just bring in another bird. Okay, so if the bird is red, I want you to do the opposite. And what would be the opposite of the movements, right? So right hand, the opposite would be left hand. If the bird will be outside, what did we do before? If he was outside, we'd say seated. And so now we're going to sit and stand if he's outside, okay? So he's not outside, and it's red, and I saw some hesitations here. I see. Okay, and he's outside, so it's standing. Yes, okay. Much harder. I dare not bring in the voice for this one. So this is red, the opposite. Oh, it's getting too confusing for me already. Wow. I can't see if you're doing it right or wrong. But you see, if we make it too complex, then it becomes really frustrating soon. I just wanted to give you an example, and of course, I have to control the time. Can you just guide me on what time we have? 10:45. So it's until 11, right? Oh, okay. I did want to bring you another activity, which I was going to consider the warm-up. It seems I talk too much now.